How long will the pain from L4, L5, S1 last? That's the question I'll be answering in today's episode number 2 of Ask Dr. Walter video series that I'll be uploading each and every day in my office. And each and every day I will answer 1 or 2 or 3 questions from the comments that you leave, so your question can be featured next in this new series that I'm doing daily. So before I do that and answer this question, let me give you a little tour of my office. And this is one of the structural rehabilitation traction rooms that we have. So you'll see over here, that's called the Universal Traction Station. We can do full spine traction setups, cervical, thoracic, lumbar spine, all in one sitting on that. Over here is Pope 2-way traction station that's more designed for cervical spine structural rehabilitation and traction. Some of the actual tools and stretching bands that we use to help strengthen and rehabilitate people's necks and spines. And then over here on this side is my other traction room. So here's another universal traction station for full spine setups. And then over here is a 3D traction table called the Dental traction table. See right there, there's a couple arms that go with that, and you see the full table there, also for full spine traction. So as you know, I'm a corrective care chiropractor in Vaughan, Ontario, Canada. On top of traditional chiropractic adjustments, we also provide corrective chiropractic care and chiropractic biophysics. That's one of the techniques that I'm certified in, called chiropractic biophysics. So let me get into this question today. So this question is by Sadia. Sadia asks, how long will the pain from L405 S1 last? Okay, how long will the pain from L405 S1 last? 1 month is over, but I still feel a bit of pain. Fortunately, I'm able to lay down and sit, but I can't stand and walk. I've been taking medicine, bed rest, and physiotherapy session for a month now. That's a great question. And first of all, I want to acknowledge that this person, Sadia, you're doing something for your problem to solve it, to help with the pain, mitigate the pain, and you're also doing something therapy-wise as well, which is good to do physiotherapy. One of the biggest mistakes that people do is they wait too long to do some kind of professional treatment for their back condition or disc bulge condition. So that, first of all, is good. Second of all is when it comes to disc injuries, whether it's L405 disc bulge or L5S1 disc bulge or even cervical disc bulges, these conditions, even though the pain may be recent for some people, possibly, the actual underlying spinal condition and injury has actually been there probably for a very long time. The fact that there's disc injuries and perhaps even degenerative disc disease or degenerative arthritis on the spine means that the damage has been accumulating over years, possibly decades. So it's very unrealistic to believe or think that that the pain will completely resolve within 4 weeks or 1 month, even if you're doing professional treatment, whether it's physiotherapy or chiropractic or taking medicines or doing home exercises. It's just a very unrealistic expectation. Typically, these conditions under care. So I'll speak from my experience, okay, as a chiropractor. It may be different for physiotherapy, but as a chiropractor, typically, in my experience, when someone starts treatment right away, so the symptoms appear related to a disc bulge injury or spinal condition or sciatica, leg pain or arm pain, regardless of the situation. Okay, in this case, we're talking about L4, L5S1 area. But as long as treatment is started initially, typically I see people's pains resolve and condition resolve, or at least improve by 50 to 80% in the first 3 months or so, okay? Everyone is kind of different. Some people a little bit earlier, some people a little bit later. But that's typically what I've seen in many of my patients that suffer with disc bulge in the lower lumbar spine at L405, L5S1 area. I had a patient, actually 2 patients recently, 2 patients in the last 6 weeks. They came in immediately when their symptoms appeared. So one of them had back pain and leg pain and trouble walking, and the other one also had back pain and leg pain and also trouble walking. In fact, both of these individual patients were being carried in by their spouses. They were both women, and they're both being carried in by their spouses around the same time. And one of the things they did was they started their chiropractic adjustments and care immediately. So literally within weeks, 4 to 6 to 8 weeks, their pain improved 60 to 80%, their walking improved, their posture improved as well. So I've seen that often, okay? Now, if the problem's been there chronic and there hasn't been really any therapy or treatment done over the span of several years since the symptoms have appeared, so maybe the problem's been there for like 6 months, 12 months, or even 2 years, okay, 1 to 2 years, then it's very foreseeable that condition can take up to 6, 9, or even 12 months to get better. Okay, I had a patient that came in and he's had this bulge injury and pain, back pain related to this bulge injury and limited abilities and mobility, and he's had it for 2 years and has done nothing about it. Okay, well, in that situation, because of the chronic inflammation, the scar tissue that's developed, the chronic emotional things that are associated with back injuries and disc injuries and back pains, his problem took a long time to stabilize. Okay, so if you tackle it right away, like in this case, within 1 to 3 months, you should see some response and improvement. And if you wait longer, it can be up to 6 to 9 to 12 months to see changes. Okay, so again, these are generalizations, but that's something that I've seen pretty consistent with my patients that I've seen with that timeline. Okay, so that's the answer for today's question on episode 2 of Ask Dr. Walter. Now I want you to continue on, and if you missed any of these other questions that were answered, go ahead right here, right there, go right there and go to the actual playlist of Ask Dr. Walter. They're short videos. You can actually binge watch a bunch of them, and if you missed any, you can catch them right over here. So continue your learning on my channel by watching that video right there.